Good afternoon. My name is Cyndy Wright-Johnson. I am the EMS for Children's Director at MIEMSS and the Maryland Safe Kids Chair. It is my pleasure to be presenting on pediatric medication safety as part of our Safe Kids and Risk Watch Coalition across the state. This year in 2021, this will be a virtual presentation, but I want to reassure you that just as in the past, in the future, we will have interactive educational tables at convention where not only can families learn how to keep medications safe and appropriately give medications, but we will also provide mentorship for young adults who are learning to educate in the community. Let's get started. We're going to talk about the risks of poisoning to children at specific ages. We're going to look at where children find medications. We're going to talk about a new program that's been out for about 5 years to help middle school children or latchkey kids learn how to administer their own medications and do medication math and do it safely. We'll also talk throughout the presentation about where to get additional resources, materials to use as you educate and reach out into your own communities. The information that I'll be sharing comes from 2 sources. One is from Safe Kids Worldwide, which has pulled together information based on research funded by Johnson & Johnson, as well as from the Center for Disease Control. The second source is the Maryland Poison Center and their 2019 report. I do not have any financial interest in any of those organizations or in anything I'm going to talk about today. I have nothing to disclose except that after 40 years, I still think kids are the most important thing that we take care of in the state of Maryland. Top 5 things we need to focus on. There will be top 5s and top 10s as we go through this lecture. We're going to talk about how kids find medications, how medications can safely be kept away from children, and what they will do to try to find them and get into them anyway. We're going to talk about what children can reach and do and say at different ages. We're going to talk about the importance of calling a medication and keeping things in original packaging. And then we're going to talk about how to educate, empower, and inform our families so that it isn't just one adult, it isn't just the person listening to this broadcast, but it's everyone creating a safety net for children. Why is this important? Well, the numbers are very telling. Every minute, a parent somewhere in this country is calling a poison center about a medication poisoning. It happens in the blink of an eye, and it happens too frequently. Annually, across the United States, more than 47,000 children are seen in an emergency department because of a poisoning. About every hour, 5 young children are taken to an emergency department by an emergency medical services 911 response vehicle. Many more children arrive by personal vehicle, but we do want families to know if they have concerns, if the child is physiologically not responding well, we want them to call and we will be happy to transport them. And of those 47,000, just over 12,000 of those children end up needing to be hospitalized, some for observation, some for hydration, and some for very complex treatment of their critical illnesses. All of these numbers have one thing in common. They are preventable. In Maryland, in 2019, the most recent aggregate full year report, the Maryland Poison Center received calls. More than 36% of them were for children under 6 years of age. About 7% were from children 6 to 12. Another 9% were youth 13 to 19, and the group of early 20s through middle age is another 35%. And then those who are over 60 are 10%. This is for all types of exposures, not just medications. And unlike other injury risk areas that we talk about, the exposure by gender, boys and girls, men and women, is just about even. There are differences at different ages, but it is not the dramatic 30 to 70 or 40 to 60% difference that we see in blunt injury. If you listen to Dr. Karen O'Connell's pediatric trauma talk on Saturday of this 2021 convention, you will remember, or if you go back and watch an archived version, that blunt trauma, it is still true. There are many more incidents in men or in boys than in girls. Why, where, and what? Why are we seeing this? Well, of the exposures for the Maryland Poison Center in 2019, ingestion was 58% of the calls that they received. 25% were contact poison exposures, and 7% were inhaled. There are those that are not known, and those are for incomplete calls. And then, as you'll notice, eye and bites and stings are much smaller. Over 50%, in fact, almost 60% of these poison exposures occur in our homes. 25% of the calls received by the Maryland Poison Center are coming from healthcare facilities, not only acute care hospitals, but also long-term care and satellite clinics. The reason for that is that as a family arrives, whether it be with a child or be with a senior adult or someone their own age, the doctors and nurses know how to treat the physiological symptoms, but it's impossible to memorize and have access to everything that every substance that is manufactured in this country and abroad is made of. And that's why we have the poison centers. They have access to that. They are not distracted. They are talking to one person at one time and can give them all of the latest information on compounds, chemicals, and exposures. And about 6% last year were EMS clinicians. Sorry, the word says providers, but this is an annual report from 2019 from the Maryland Poison Center. But about 6% are from EMS providers who are calling from the field, asking for advice, which is very appropriate. If an EMS clinician calls and talks to the Poison Center and then goes on about treatment, the Poison Center will also notify the receiving facility and do a follow-up call so that they're sure the physicians don't need any additional information. Obviously, patient report and notifying the hospital that we're coming is still our responsibility. Most of the calls to the Maryland Poison Center and every other poison center across the country are for human exposure. There are also people who call for information, and they're very happy to receive, answer, and provide information. If we want to request printed material, they ask that we call their business number or just go online and order it, and they'll send it to us in small quantities for free and otherwise just at the cost. And about 1,000 times a year, Marylanders call because an animal has gotten into something. Most of those, every poison center can handle, but there is a set of poison centers that have veterinary consultation 24/7. You might get referred on to one of those poison centers. Most of the calls are unintentional. In fact, when it's children under 6, almost all of them are unintentional. The number to look at right here is that 30% of the exposures in our teens, 13 to 19, were unintentional. You do the math, that means 70% of the time when a teen is taken a medication or been exposed to a poison, it was intentional. And they either had a change of heart and luckily called the poison center, or someone found them and called the poison center for them. And in our older adults, most of the call, well, 2/3 of the calls are for medications. I was very surprised in 2019 to see that only 600 calls came from grandparents taking care of their grandchildren. I thought that number would be higher, and when we look at the 2020 data, it may be, but that has been consistent over the last few years. And now time for the pop quiz. When I say call the Maryland Poison Center, what phone number is that? Or the National Capital Poison Center, or the Virginia Poison Center, or the Delaware Poison Center? If we were together, I would ask that everyone shout it out. Hopefully you already have this either programmed into your cell phone or posted in your home in a place where it would be easy to find. 1-800-222-1222. There are a number of videos of various caricatures singing this number, but I will spare you. What types of medications? This again is Maryland data, 2019, top 10 drug substances for the calls that were received by the Maryland Poison Center. It isn't just prescribed medications that a doctor, nurse practitioner, or physician assistant writes a prescription for. This includes over-the-counter medications for pain or fever, vitamins and supplements, allergy meds. It includes topical eye drops, as well as any kind of not only diaper rash, when this is a Safe Kids image, but also any type of cream that we would use, whether it has medication in it or it has herbal substances in it. We need to keep them up and away from kids. What can we do to keep things up and away has been a national campaign of Safe Kids worldwide, the Center for Disease Control, and Health and Human Services for many years. Health and Human Services is the federal agency that provides funding for that 800 number and gives some funding through our federal tax dollars to every poison center across the country. We want to store medications safely, and we'll go through the risks there. We want to give medications safely, and I'll talk about the key acts that we need to take and the key things we should not do when we're giving medications. We want to get rid of expired medications or medications that we're not going to use anymore. If we need medication in the future, we can get a prescription and use that new prescription in the appropriate amount. It might not be the same. It's not advised to keep medication for a rainy day. Use it completely as prescribed, and then get rid of it. And we want to educate everybody in the family when children are around how to keep them safe. So let's go to where kids are finding medications. Typically, this is a show of hands. Pill boxes on the ground, in your purse, bathroom or kitchen counter, or reaching for in a cabinet or getting into a refrigerator. Which do you think is the most frequent? The most recent study, published in 2020 by Safe Kids Worldwide, a compilation of information from all the poison centers as well as the Center for Disease Control and emergency department data, shows us that 23% of the time the child got it from where we stored it. It's in a pill box or it's in a bag of pills, not advised, but it does happen, or a bag that has a series of pill bottles in it. So we put it in the correct place, but we didn't keep it up and out of the way. Equally, 23% of the time, it has fallen on the ground, it's been misplaced, it's in the carpet, it's on a counter, it rolled under the Lazy Susan, and a child finds it. Most people think it's going to be in your purse or backpack or a family member's, but that's actually only 19% of the time, still significant. 1 in 5 times. Bathroom counters and kitchen counters are almost the same. And then only 8% of the time as a child actually physically got into a cabinet, into the refrigerator, and found a medication. Medication storage is really important. What's demonstrated here is a family member who has counted out their medications for the week, made sure the right doses are there, and taken probably their morning medicines, but did not close the pill box or the pill container and didn't put it away. If you look closely, that is actually a pill container that does have a safety latch on it, but it is simply a latch, and any of those could easily be popped by that 4-year-old child. We want to keep them up and away, out of sight, and in many situations behind a cabinet that actually is child resistant, has a catch on it that you have to know how to unlatch. We want to put them away after every use, not leave them out because we're going to come back at lunch and take another dose, or leave them out for our dinner time. We also want to be sure that medications, whenever possible, are kept in their original containers. What we saw in the last slide of planning out medications over a week is very common, and often we end up doing that for our older family members. But when possible, and if it's a specific medication that's going to be used for only a short period of time, we want to keep it in the original container so that the person it is for, the timing and frequency of that medication, the type of medication, and the route to take it are all right there. This is true for over-the-counter medications as well. We also, when possible, want to use child-resistant packaging. There are those in our families who cannot open those. I might be in that age bracket by now, but I want everyone to read those words, child-resistant. According to Consumer Product Safety, a child-resistant packaging, whether that be a cap or whether that be another type of packaging, is meant to keep a 4-year-old from gaining access to that packaging for 3 minutes. It is meant to be a just-in-time period where the child should have difficulty getting into it, but with enough time, with enough practice, or with enough determination, it is child resistant. It has never been child proof, although many of us used that term 10 or 20 years ago. When we talk also about medication safety, I want you to remember that children get into things with a variety of different innovations. They can get into cabinets, they can push furniture up to sinks and reach over them. They can get up on the cabinet and reach the top of the refrigerator. Sometimes they're going for the cookies or the potato chips, but other times they find medications that are not safe. And typically they are now more than twice their height, and so we have a whole nother risk area to talk about on another day. All of what I've said is summarized really nicely in this poster. This is a poster available from Safe Kids Worldwide. It is in the public side of their website. We have brought this to convention for at least the last 3 years in 8x11 color printouts, and we will have additional copies of those. We have it in a PDF, and we're happy to email it to anyone who wants to make copies for open houses or for health fairs and educational opportunities. If there's a need and we get a lot of feedback, we'd be happy to make it in a 12x24, about the same size as all of our bike helmet and our newer child passenger safety posters. Just send us an email and we'll work on getting that ready for everybody for either fall or for June of 2022. Risk factors about what time, not where, but what time children are seen to have the most exposures. Monday through Sunday seems to be just about the same. Most frequent times are during meals. The most frequent situations are when either visitors are in the home who don't know to keep things or aren't familiar with the developmental age of that child, or the child is in another home. There's also times where there is either good stress or concerning stress if someone is sick, if it's a holiday, if it's a celebration, or if the family is moving locations, whether that be for a vacation or whether that be a permanent move for the family. The next thing we're going to talk about is giving medications safely. This is a little bit shorter, but equally important. We want to read and follow the labels. Make sure that the medication is given to the person it was intended at the right time, right route, right dose, right frequency. You also want to know what is inside the medications. And one of the greatest risks that we have is when a cough medicine or a cold medicine also has acetaminophen, commonly called Tylenol, but that's a name brand, acetaminophen incorporated into it. They do that to try to help the child feel better, but we want to be sure that we read that. And in fact, many of those cold medications no longer contain acetaminophen or are very clear on their labeling that they do. Some medications can be given as frequently as every 6 hours, but others can only be given as frequently as every 4 hours. We also want to make sure that we are not combining them with any other medications or with any types of foods that would not allow for the correct absorption of that medication. They should all be printed very clearly. Sometimes it's a little bit small to read, and the medication that is prescribed should come with a series of directions that are folded, often multiple times folded, and in English and in Spanish. The directions inside an over-the-counter medication are typically in even smaller fonts, but they should be there and available. The next thing that's important is how we give that medication. Not only the dose, but make sure that we are giving it in the device that has actually been sent home with that medication. Sometimes over the counter, it'll be inside the packaging. Sometimes it will be put in by the pharmacist if they have created a medication, a liquid medication specifically, in a bottle. They will give you the right syringe or cup. It is not okay to use the teaspoon or tablespoon from the kitchen drawer or from the baking cabinet. We really need to be sure that we are using the device that was given to us for that child's medication. Because if you look at how little 2.5 milliliters is, depending on what your soup spoon is versus my soup spoon and somebody else's teaspoon, we could really have a different dose. So please use those medications and educate the general public to do the same. Setting reminders. Sticky pads take me back to the 90s, but you can write a note and put it up on the refrigerator, put it next to the phone, put it on the nightstand next to, or on the bassinet next to where the child will be. Set an alarm. Have your phone go off and tell you whether it's your medication or medication for someone you're assisting, and or write it down on a calendar or on the ever-present piece of paper on the refrigerator. One of the things we really focus on is making sure that two adults don't give one child the correct medication, but twice within a very short period of time. So if you have a number of people taking care of a child or taking care of a vulnerable adult, this medication schedule is very helpful. Or if you have two children who've managed to share whatever illness they found at your house, at a friend's house, or now that they're back in school, each child should have their own sheet of paper, so because the doses may really be different between children of different ages. We've given out about 1,000 of these printed sheets. They're about 5 by 7 at convention over the years, and we will have them again next year. But we also do have it in a PDF that's easy to either print in 8 by 11 for ease of read, or print twice on the same page. Want to write down the child, the time, when it was given, the amount of medication, and if it is scheduled to be given again. When we get help with a child's medication, if we're concerned that we're not quite sure, there are really 3 places to call. One is your child's physician or nurse practitioner, one is the pharmacist, and one is the Poison Control Center. If the child has gotten into something they weren't supposed to get into, someone else's medication, cosmetics, another substance, then it's time to call the Poison Control Center. The risk factors of children, typically when the child is very young, under a year of age, it is actually an adult error. And the Safe Kids slide says under 6 months, but it can happen between 6 and 12 months as well. The difference is between 6 and 12 months, the child may have gone and crawled in and gotten access to something. And this is a mistake. The Poison Control Center is there to help. Between the ages of 6 to 12 months, children will start to explore. They will find things. They will find small things on the floor. Medications is what we're talking about today, but plants, cleaners, and the very high risk small batteries is another concern of us. And yes, they will find it and they will try to keep it from you. And if it doesn't taste good, they're likely to try it again to see if it tastes different the second time. That's how kids learn, by exploring their environment. When we talk about toddlers, we need to remember that this is the group that throws everything off their high chair repeatedly to see if it will always get either a laugh, an interesting face, or make a great sound when it hits the ground. They can open things that we were not quite sure they could yet. And they are adept, as we saw earlier, to crawling onto all kinds of things. As the child gets older, they will be able to reach the heights of not only refrigerators, but medication cabinets, the top of mom, dad, or grandma's bureau. And sometimes they are very adept at getting into the refrigerator, whether it be in the door, on the bottom shelf, or occasionally pulling everything off the top shelf of the refrigerator. They will find a way to get to something that looks new, something that looks different, maybe something they were told not to touch, just to see if there's really a reason why. This is all normal childhood development. It's how they learn, it's how they explore, and it's how they're going to gain information. Right now, we want to make sure that we're keeping things away from them. The other group that we really want to talk about is children who are older elementary, could be middle school depending on your county school system, but older elementary and aren't likely to be getting into things in the way that young children are, but actually want to be independent. They want to take care of themselves. And if they are the youngest child at home, they may, by the time they are 12, 13, or 14, be home alone on a regular basis. They know what their medications are, but they don't always know the dosing or the issue of not combining two different medications. Scholastic worked very carefully with the poison controls, the American Association of Poison Control Centers, and has put together a wonderful curriculum that families can use, that teachers can use, and can be used at camps, at health fairs, etc. The really nice change that we've seen in this curriculum over the last few years has been that it now comes in a number of different languages, and you can download those and gain access to those. All of these resources are free of charge. They are all on the internet, and they can be incorporated into nutrition classes. They can be incorporated into reading classes. They can be incorporated into math classes. It's very easy. It's also great for Girl Scouts and Boy Scouts. It is written in a level that would need to be Girl Scouts and Boy Scouts, not Brownies and Cub Scouts, but all of the information we've talked about up until now, and including what I'm going to talk about with safe disposal, is part of our Cub Scout and Girl Scout, Boy Scout, and Brownie safety badges. And that's one of the things we try to do when we're at convention, is let the families know that if they've gone through the room and they've gone through all these different stations, they're about halfway through one of the knowledge achievements for their various organizations. This is just another shot of the website and the information that's available. There are videos, there are interactive games, and there's a great deal of information that can be downloaded. And I believe all of it can be saved to either Mac and or Apple. Most of it is in PDF form, so any of the PDF readers, and I've tried this in 5 different browsers. This is not one of those websites that you have to open in the exact correct browser to have it be compatible. They really have made this as accessible to the public as possible. We're going to call our doctor or pharmacist if we have questions about a specific medication, be it over the counter or prescribed, and about dosing or combining those medications. We're going to call the poison center when it's the wrong medication, or it was a medication that we gave the wrong amount for, or the child gave themselves the wrong amount for. And we want our community members, we want the citizens to know when to call 911. To make that right call to 911 if the child or an adult is not breathing, if they've collapsed, if they've had a seizure, or if they're unresponsive. You'll notice, I think this is the 3rd time, but it could be the 4th, that 1-800-222-1222 number is there. There are magnets, there are stickers, there are brochures, all available from both the National Capital Poison Center and the Maryland Poison Center. Sharing information about the appropriate medication for a child, the appropriate route, the appropriate dose is all something we want to do when someone else is taking care of our child. Could be a care provider, could be a babysitter, maybe a family member or a neighbor. We want to show them where we store and store up and away, what doses are given, and how to document that medication that has been given to a child, especially to be clear which child and how to keep it away from all of the other children. At this point in the lecture, if we hadn't done it at the very beginning, we would actually ask everybody to take out their mobile device and program this into their phone. When we give this lecture at community events, whether it's parents-to-be, whether it's a babysitting class, or whether it's something at the public library, we will make sure that everyone program this and then leave with some materials that have this number on it as well. We want to reassure the citizens that they can call the Poison Center 24/7, rain, sunshine, snow, sleet. They've always been able to access their materials as well as answer their phones remotely, and have actually been working remotely completely for the last 14 months at both of those centers. It is free. The information is confidential. It will not be shared with anyone unless a physician calls and says, the Smith family told me they had called you. I am now taking care of the Smith family, and I want to get additional information from you about the care of this patient. The people answering the phone are doctors, nurses, and pharmacists. They are certified as poison prevention specialists. Both the District of Columbia National Capital and the Maryland Poison Center only have certified poison center specialists answering the phones. And they've had lots of experience and lots of continuing education. The last aspect of medication safety is, what do we do when we don't need this medication any longer? We want to make sure that the medication is put into the trash appropriately. We want to mix it with something that not only is not a child who is curious, but an animal who is curious is going to get into it. Coffee grounds are typically available. You can use dirt, unused cat litter. You can also use sawdust or something else if that's available. We want to seal the medication, if it's pills, into a plastic bag or into a container that actually has a twist lock on it. And we want to put that in the household trash. What we do not do any longer is flush, whether it's flushing down the toilet or putting down the laundry sink. That gets into the water system, it seeps out into the soil, and it exposes animals, it exposes fish, and ultimately it comes back to us. And over our past traditions of throwing things out that way led in the early 90s to very high levels in both meat and fish that we were consuming that had medications that were never prescribed for those animals. We also do want to remember to take the personal information off that packet. Another way to get rid of medications is National Take Back Day. I am taping this on the 28th of April, and our last Take Back Day was last Saturday on April 24th. It is typically 10 to 2. There are locations that are open a little bit longer, and there's always a September and an April date. This used to be the only times that there were take back programs, but in every jurisdiction, there are additional locations that either 7 days a week or at least 5 days a week will take medications back. On National Prescription Take Back Day, most of our pharmacies are also participating along with our law enforcement partners. But the law enforcement partners do have locations, not everyone in a given county or jurisdiction, but do have them that will take medications back. What's important to know is while it is National Prescription Take Back Day, all of these locations will take all of your medications. So those maternal vitamins that you don't need any longer because the baby is already here and are so high in iron that it could harm a child, those can be taken back. Other medications that have Tylenol in or acetaminophen in both of them, those can be taken back. They take them all, and then they actually report out. We'll see a report in about 45 days of the pounds of or tons of medication that were collected over last Saturday, which is last Saturday to me. I apologize. It was 2 months ago by the time you are listening to this. There are 2 handouts that are available from the Maryland Poison Center on a regular basis. If you look to the left of the screen, you will see the Poison Prevention Press. This comes out every 2 months, and it focuses on information for families, for teachers, for childcare. If you look to the right, you will see Tox Tips. This is typically a 1-page, comes out monthly, and it is an update on what they are seeing clinically and what emergency departments have reported to them. Again, both are easy to download. You can also sign up to get their email, and they will put you permanently on their email until you ask to be, quote, unsubscribed. I want to thank you for the time that you have put into spending with me today. If you have any suggestions or any requests for information, please feel free to email us. They all show up on my desk, riskwatch@msfa.org or safekidsmd@miemss.org will all show up, and we will be happy to provide you with the resources that we have and link you to other resources. If you're looking for large quantities of information on poison control, both the Maryland Poison Center and the National Capital Poison Center have additional teaching resources and will come out and do training for large events. This is typically not done at a station or a small community event, but at a county level event. I also want to let everyone know that if people want to learn how to give these lectures and have a training in how to do poison prevention training, the Maryland Poison Center has a Train the Trainer curriculum. And if we can put 20 people in the same place, they will come and do the training. And that would actually be a certified poison specialist who would be providing the training and bringing handouts and materials. On behalf of the 7 Safe Kids Coalitions, Baltimore City, Carroll County, Frederick County, Howard County, Montgomery County, Prince George's County, and Washington County, and the community partners of our Safe Kids State Coalition in Allegheny County, in Arundel County, Cecil County, Charles County, Garrett County, Queen Anne's County, and Wicomico County Peninsula Regional Medical Center. I want to thank you for being involved in the 2021 MSFA convention and learning new information or having information about poison safety reinforced. Enjoy the summer, be safe, and we look forward to seeing you in 2022.
California Casualty has been endorsed by the MSFA for 10 years for its auto, home, and renter's insurance. It is our honor and privilege to protect those who protect our communities. Happy 10-year anniversary to the members of MSFA. Thank you for all that you do. For more information about our program, please visit www.calcash.com/MSFA. We look forward to seeing you at various local, county, and state events.